Part 1. The first cut always hurt the worst. You ever get a splinter so deep it makes your teeth ache? Now imagine that splinter's a bullet, or a rusty nail, or the sharp end of a cow horn. And the nearest doctor is 300 miles. That away, through desert, coyotes, and bandits. That was the medical reality for cowboys in the Wild West. If you got sick, infected, or broken, you didn't go to the clinic. You reached for a bottle of whiskey, a hot knife, and someone with enough guts to hold you down. There were no antibiotics, not even aspirin. Infection didn't mean a quick trip to the pharmacy. It meant fever, swelling, pus, and maybe a slow, rattling death. Cowboys didn't fight infections with medicine. They fought them with heat, steel, and pain. Whiskey wasn't just for drinking. First rule of cowboy medicine: get the patient drunk, not tipsy. Drunk, slurring, drooling, can't remember his name. Drunk. Whiskey dulled the pain, if only a little, and it made the screaming slightly more tolerable for everyone. Within earshot, a bottle was passed around, not to toast the cowboy's health, but to brace him for what came next. The same whiskey was also poured directly on the wound. Why? Because nothing else was clean. Water was full of parasites. Bandages were reused. Saddle rags. So if it stung, it meant it was working. And if you didn't have whiskey, some used moonshine, some used kerosene. One poor soul in New Mexico had bear urine. They said it worked, but nobody asked twice. Boiling metal. The poor man's scalpel. Cowboys didn't carry surgical tools. They had Bowie knives, branding irons, and horseshoes. If something needed cutting, that blade went into the fire until it glowed like hell's door. Then they'd cut deep, fast, and without hesitation. Abscess on the leg. Slice it open, drain it out. Bite on the stick, partner. Infection creeping up from a gunshot. Better dig out the bullet with a red-hot poker. If you're lucky, the heat killed the germs. If you weren't, well, at least it cauterized the wound before you bled out. They called it cut and burn medicine. The cut got the poison out. The burn sealed your fate. Smoke was medicine, sort of out on the range. Cowboys believed smoke could kill infection. Not metaphorical smoke, actual campfire smoke. Some would place infected wounds near smoldering coals and smoke the rot out. Others used tobacco smoke. Yes, tobacco, blown over the injury like some unholy blessing. There were even folk remedies where powdered tobacco or ash was packed into the wound to draw out the fever. It didn't work, of course, but it sure made the wound look worse, which meant folks gave you more space and stopped asking you to chop firewood. Pus wasn't the problem. It was the progress bar. In the 1870s, pus wasn't a red flag. It was a sign that your body was working. Cowboys thought the creamy stuff meant your blood was fighting off the evil. As long as it drained, you were fine. If it stopped draining and started smelling like sour milk and bacon grease, then they worried. That's when they'd grab the knife again, open the wound wider, let it breathe, they said, and maybe toss some sagebrush in there, because why not? They didn't know what bacteria were, but they knew the smell of dying flesh, and that was usually a sign to ride fast to the nearest town, if you could still walk. Amputation. The cowboy cure. Also me times, when a leg swelled up like a melon and turned the color of a week-old bruise. There was only one solution: cut it off. No anesthesia, just whiskey, muscle, and iron will. One guy held your shoulders, another held your leg, a third one, hopefully sober, did the sawing. They didn't have bone saws, just regular wood saws. And if the blade was dull, too bad. You had maybe a minute to scream before you passed out or bled dry. Cauterization followed, a branding iron shoved into the open stump. They said if the cow didn't cry during branding, neither should you. The real heroes, the ones who watched being injured, was bad. Being the guy who had to fix the injury, worse. Trail bosses doubled as field surgeons. Cooks sometimes performed tooth extractions with spoons. One story tells of a cattle rustler who dug a bullet out of his own shoulder with a fork and mirror. Cowboys weren't doctors, but they were stubborn, creative, and dangerously confident. And that was usually enough. Next time, in the next part, we dive into the truly bizarre: why cowboys trusted moldy bread, how smoke-filled tents became operating rooms, and what happened when someone suggested bloodletting and met it. Because when you're hundreds of miles from help, even the craziest remedy starts to sound reasonable. PART2, mold, mud, and madness. The wildest cures on the fronty air. Let's say your leg's swollen. It's hot, it's red, and you can smell something awful even before you pull off the boot. You've already poured whiskey on it. You've already cut it open and burned it shut. But the infection's still climbing. What now? Now comes the weird part. Because out on the range, cowboys didn't just rely on heat and steel. They had folk cures passed down from grandpappies, old wives, drifters, and one-eyed prospectors who swore they once seen it work. When all else failed, they turned to whatever they had: moldy bread, hot smoke, or just good old-fashioned bleeding. Moldy bread, the accidental antibiotic long before science gave mold a fancy name. Like penicillin, cowboys noticed something odd. Wounds packed with old bread sometimes healed better. So if someone had a slice turning green in their saddlebag, boom, medicine. They'd tear it up, soak it in spit or whiskey, and slap it on the wound like a poultice. Wrap it with a rag, say a prayer, and hope it didn't just attract ants. No one knew why it sometimes worked. It probably didn't, most of the time, but the alternative was rot, gangrene, and losing the limb. So green bread didn't seem so bad. Ash, mud, and animal fat. Another favorite remedy. Take fireplace ash, mix it with warm bacon grease, and smear it on the wound. The logic: ash dried things out, fat kept it soft, and if you added crushed tobacco leaves, you were basically a frontier pharmacist. Others swore by mud, cool, wet, prairie mud. It was slapped on burns, cuts, even infected abscesses. They said it drew the fire out. What it really did was make things dirty, stink worse, and invite insects. But again, it felt better than nothing, which was usually the only other option. Smoke tents, dye disinfection cattle drives. When one cowboy got sick, others panicked. There was no real concept of germs, but they did believe in bad air. So they built smoke tents, canvas shelters filled with burning herbs, damp wood, or even dried buffalo dung. The sick were made to sit inside, sweating through fever as smoke filled their lungs. If they survived, it was a miracle. If they didn't, well, at least they smelled like sage and cedar on the way out. One ranch used chili pepper smoke to purify the lungs. The patient choked, cried, and sneezed for 2 hours straight. The rancher said it worked. Everyone else left camp for a week. Bloodletting, still a thing. Unfortunately, you might think bloodletting died out with medieval. Barbers, think again. On the frontier, some old-timers still believed the best way to cure infection was to let the poison out. They'd cut a shallow slice near the infected area and bleed it, sometimes for minutes, sometimes until the cowboy passed out. The goal was to release the heat. What it really did was make things worse, weaker, and more likely to end badly. But when someone's leg looked like a balloon filled with gravy, a little bloodletting didn't seem any crazier than stuffing the wound with mashed beans and mold. The cactus cure. Yes, really desperate cowboys sometimes tried dessert plants. One favorite, prickly pear cactus. The pads were burned, peeled, and mashed into a hot poultice, then slapped onto wounds as a drawing salve. Some said it cooled the swelling. Others just liked that it stuck in place better than bacon. Mesquite gum, snake root, even wild onions were brewed into teas, not for drinking, for cleaning wounds. If it stung, it was working. If it made you scream, you were getting better. One fella in Arizona swore he cured his infected toe by sticking it into a dead rattlesnake's mouth. When it didn't fall off, he called it science. Cowboys versus the itch. That meant death. Own cowboy saying went: if it itches, scratch it. If it oozes, burn it. That was their entire dermatology textbook. Skin infections, boils, saddle sores, all common and all dangerous. What started as a red patch could become a flesh-eating horror show by the end of the week. Without antibiotics, the skin just peeled away, leaving raw meat behind. Some cowboys packed the area with salt. Others held red-hot coins to it. A few chewed tobacco into a paste and rubbed it on. The result: more pain, less dignity, and often, surprisingly, survival. Not because the treatment worked, but because cowboys were too stubborn to die. Coming up next, in Part 3, we dive into the most terrifying treatments of all: tooth infections, jaw rot, and brain fever. You'll meet the cowboy who pulled his own molar with pliers, the camp cook who performed eye surgery with a sewing needle, and why headaches were treated with hammer blows. We wish we were kidding, because in the Wild West, if it hurt, someone had probably tried to fix it with fire, whiskey, or a rock. Part 3: Teeth, Fever, and Frontier Madness. If you think a gut wound was bad, try living with a rotten tooth on the frontier. Cowboys feared toothaches more than bullet holes. Why? Because you could patch a bullet hole with a rag in prayer. But a festering molar, that pain crawled into your ear, down your jaw, and straight into your soul. And when it started to swell, well, that's when the real horrors began, out on the range. There were no dentists, no Novocaine, no little chair with a light and gentle hum. Just rusted pliers, strong coffee, and the kind of pain that made grown men cry into their saddlebags. Toothaches were a death sentence. Sometimes literally, an infected tooth could kill. Once the rot spread into the jaw, cowboys called it blackbone. The side of your face puffed up, hot and throbbing. You couldn't eat, you couldn't talk, and at some point, you'd start to drift, dizzy, sweaty, and talking nonsense. That was when they called it jaw fever. If it moved to your brain, they called it ghost fever. You'd shiver, scream, and sometimes wander off into the desert to die in peace or madness. There were no antibiotics to stop it. Just one solution: yank the tooth, fast and rough. Tooth pulling. The cowboy weight tools were basic: fence pliers, tongs, a hunting knife jammed in to wiggle the roots loose. If you were lucky, they'd heat the metal first, not to disinfect it, but so you'd pass out from the burn instead of the pull. The patient sat on a crate, biting a leather strap. One man held his head, another yanked with all the force of a stagecoach mule. If the tooth shattered, too bad. They'd go digging for the pieces. One story tells of a cowboy who pulled his own tooth with a hammer and a nail, drove the nail into the wood, tied it to the tooth, then kicked the wall. It worked. He celebrated with jerky and whiskey on the other side of his mouth. Brain fever, when a headache wasn't just a headache and fever got into the skull. Cowboys called it brain boil or hot mind. You'd see the signs: confusion, wild eyes, mumbling, sometimes violent outbursts. They thought the brain was overheating, like a kettle left on the fire too long. So they cooled it down the cowboy way, with cold river water dumped straight on the head, or with smoke tents packed with mint and sage. One rancher tied ice blocks to a man's head using saddle straps. Another tried bleeding the madness out through small cuts behind the ears. None of it worked, but it kept everyone busy until the fever either broke or the cowboy did. Surgery with a needle and a spoon. Minor operations. That was campfire territory. Need to lance a boil? Use a sewing needle. Got something stuck under the skin? Dig it out with a spoon. One cattle boss carried a bent fork specifically for splinters. Another stitched up gashes using horsehair soaked in spit. The fire was the disinfectant. The whiskey was the anesthesia. The screaming was part of the process. And if the wound got infected, back to the knife, back to the fire, back to hoping. Infections and the dust cure out on the plains. Dust storms kicked grit into every crevice, eyes included. Pink eye, styes, and even worse plagued the trail. Cowboys treated eye infections with rinses of cold coffee, or even their own urine. One legend says a blind drifter in Nevada offered eye blessings, which meant spitting in your eye and calling it holy medicine. In desperate cases, they used tiny knives to cut the swelling, or they'd press a hot coin to the eyelid. It didn't cure anything, but it gave a strong excuse to skip the cattle drive for a few days. The shakes, the chills, the camp death, malaria, and typhoid swept through camps without warning. One day, you were eating beans. Next, you were shaking so hard you spilled your own coffee. Cowboys called it the cold sweats or camp death. They didn't know about bacteria, just that it spread fast, usually after bad water or bad beans. The treatment: wrap the man in every blanket you had, feed him boiled sage, sweat it out, and if he survived the week, they said he was blessed by the dust gods. If he didn't, they buried him on a hill, boots on, hat off, and a tin cup placed over his chest. Coming up next, In Part 4, we uncover the final, most brutal frontier cures, amputations with axes, snakebite whiskey baths, and what happened when a cowboy begged to be saved, but no one wanted to touch him. Because in the Wild West, survival wasn't about clean hands. It was about grit, guts, and the fire to keep going, even when your teeth were gone and your brain was boiling. Part 4, the last resort, fire, fear, and the will to live when infection went too far, when the wound turned black. The fever climbed past words, and the smell turned the horses skittish. There was only one thing left to do: cut it off, burn it out, or pray over the grave. Cowboys knew it, trail bosses dreaded it, and campfires went quiet when someone muttered the word nobody wanted to hear: amputation. But don't imagine a clean hospital room. No white coats, no polished blades, just a stump, a saw, and someone yelling, "Hold him down," axes, hatchets, and the fastest cut in the West out on the plains. No one had a surgical bone saw. If a leg had to come off, they used what they had, often an axe, and the faster, the better. The patient got a bottle of whiskey. If he could drink, he drank. If not, they poured it over his chest and hoped the smell would keep him conscious. 2 strong men held the cowboy's arms, another pinned the leg. Then the cutter, usually the trail boss or cook, raised the axe and swung hard. 1 strike if lucky, 2 if it was a thick bone, 3 if the axe was dull, and by then the screaming had already turned to silence. Cauterization, hell's brand. Bleeding to death was the biggest danger. So after the limb came off, the stump got seared shut, usually with a branding iron pulled straight from the fire. The smell? Worse than any cattle drive. The sound? A wet hiss like bacon on a skillet. The pain? Indescribable. But it sealed the vessels, it stopped the bleeding, and it gave the cowboy a chance. Just a small, smoky chance to live. Some cowboys never forgave the man who swung the axe. Others thanked him every time they saw their empty pant leg. Snake bites, whiskey baths, and fire ring snakebites were common, especially rattlers hiding in boots or under bedrolls. The first rule: don't panic. The second: cut the bite open and suck out the venom. Or so they thought. In truth, that didn't help, but it gave the helpers something to do. Some cowboys heated a knife and burned the bite. Others built a ring of fire round the wound, believing smoke would stop the poison. And some, in pure desperation, sat naked in a barrel of warm whiskey. Yes, full-body whiskey baths. Expensive, rare, and almost always pointless. But if you were going to die, might as well go out smelling like saloon gold. The untouchables. When cowboys got too sick, there came a point when infection turned a man into a ghost, half alive, half gone, with eyes that didn't see and breath that rasped like rusted gates. That's when the camp made distance. No one wanted to touch a dying man, not out of cruelty, but fear. Fear of catching it, fear of watching it, fear of hearing your own cough a day later and wondering if it had started. Some were left wrapped in their blankets, placed near the river, with a canteen and a last smoke. Others were carried to shade and given their revolver, just in case they didn't want to wait for the fever to finish. These were the quiet deaths, the ones nobody wrote songs about. Frontier graves and trail markers. If the cowboy died, they buried him fast. Infection spread quick, and there were no embalmers riding behind cattle herds. A shallow grave, a pile of stones, maybe a cross carved from fence wood. His hat stayed behind, placed over the mound. Sometimes his boots too, if they weren't, needed by someone else. And if he survived, he came back a legend. One-armed, toothless, scarred from shoulder to hip, but alive. They said a cowboy wasn't measured by his hat or his horse, but by how many times he came back from almost dead. The will to keep riding in the end. The real cure for infection on the frontier wasn't a plant or a potion. It was grit. Cowboys kept moving. They rode sick. They limped on swollen feet. They stitched their own wounds with fishing line and scorched their infections just enough to keep going. There were no miracles, just men too stubborn to die, chewing tobacco with abscessed gums, dragging shattered legs through dust and laughing through fever like it owed them rent. The Wild West wasn't clean. It wasn't kind. But somehow, in the middle of it all, they survived. Not because they had medicine, but because they had fire, and pain and smoke. Final words. So next time you hear a cowboy story with clean shirts and polished boots, remember this: out on the real frontier, survival wasn't pretty. It stank, it hurt, it bled. But those who endured it left behind more than scars. They left behind legends.